Hello and welcome to our presentation. For this group project, we focused on how Project 6 works in partnership with the NHS to support service users with substance misuse, rehabilitation and overcoming relapse. Okay, now Sinai will give you a brief overview of how this presentation will be.
So first we'll be going through the overview. First we'll be going through the key definition and statistics of addiction, relapse and rehabilitation. Then we'll be moving on to the partnership between the NHS and the voluntary sector. And then afterwards we'll be following through with the recovery stages. There are 5 stages in the recovery stage, and in each stage we'll be talking about how Project 6 works in partnership with the NHS to provide specific services to help service users progress in each stage and overcome addiction. Then we'll be following through with our key learning points as a group. And then afterwards, we'll be going through our reflections of how we worked as a team. And then we'll have a references and then the Q&A and then any other questions at the end.
So look at the key definitions and statistics. Addiction is defined by the NHS as an inability to maintain control over using substances that could be harmful to you. So in our case, drug addicts have an inability to stop consuming drugs. Alcoholics have an inability to stop consuming alcoholic beverages. For relapse, it's the deterioration of an individual's health after a temporary phase of improvement. So what this is typically happens over a period of sobriety. A person returns from their pre-addiction phase to a state of addiction. And with rehabilitation, it's essentially the opposite of relapse. It's a process of restoring someone's health through training and therapy. And what that is essentially is restoring a person's health from post-addiction to pre-addiction. And this can be done through either therapy, such as counseling or medication. So look at the key statistics. We found that between April 2019 and March 2020, approximately 3.2 million adults aged 16 to 59 had taken some form of illegal drug, and of that 3.2 million, around 270,000 had been in contact with some alcoholic or drug rehabilitation service. So it shows that there's quite a large disparity between people taking drugs and people seeking help for their issue.
Okay, for this section, we'll focus on NHS and the voluntary sector as a whole. Then we'll look at Project 6 and NHS in more detail later on in this presentation. So the NHS and the voluntary sector worked effectively to provide numerous treatment plans for patients suffering from substance misuse. Patients have the right to choose their treatment plan according to preference and convenience. By providing multiple treatment plans for patients suffering from substance misuse, the NHS and the voluntary sector hope to positively influence its service users to adopt good behaviours that can improve their well-being. So let's look at NHS specifically and what they provide for their patients. The NHS, it's important to note that the NHS works in partnership with both voluntary and the private sector. For patients willing to get treatment for addiction, NHS recommends consulting a general practitioner or attending a local drug service for their drug addiction if they're not feeling comfortable attending a general practitioner. The NHS also offers treatments at hospitals as inpatient at home or residential rehabilitation facility depending on the patient's personal requirements. Now let's look at the voluntary sector and what they provide for their service users. The voluntary sector offers self-directed treatment options. Typically in a first appointment, a key worker will be allocated to an individual and together they'll go over details about their drug use and ask questions about their personal life in order to arrange the most suitable treatment plan for them. Okay, now let's look at the recovery stages.
Project 6 has a multi-stage rehabilitation program. The first stage of rehabilitation is the hardest as individuals have to stop consuming alcohol or drugs or whatever their addiction is. This detachment stage usually lasts between 1 to 2 years. There are frequent meetings with the service provider to establish a good relationship and help build habits to avoid cravings. Furthermore, possible hindrances identified, like negative influences from bad friends or certain places that cause cravings. These meetings are to help the service user feel easy in starting his rehabilitation program. Now moving on to stage 2.
Stage 2 of the recovery is known as post-acute withdrawal stage. This stage of recovery is where relapse is most prevalent among service users. The reason for this is that post-acute withdrawal syndrome has psychological and emotional symptoms rather than physical symptoms. Emotional symptoms are more challenging to deal with as symptoms are known to be similar to depression. The symptoms may include mood swings, anxiety, irritability, varying concentration, and disturbed sleep patterns. As mentioned earlier, in stage 2 of recovery, individuals are more prone to relapse as post-acute withdrawal syndrome lasts up to 2 years, with symptoms varying in severity and pattern. The unexpected array of symptoms within the 2-year period increases the risk of relapse as an individual may not be psychologically prepared for it. For individuals in the second stage of recovery, the NHS provides talk therapies such as the cognitive behavioral therapy known as CBT. CBTs are designed to help individuals reflect on their own thoughts and feelings and how it might affect their behavior. For people who may not feel comfortable attending a CBT, Project 6 offers a scheme called Sober Socials. Sober Socials are group therapies where individuals can discuss their journeys and struggles through relapse, and this scheme is designed in order to help build those individuals' resilience and confidence by interacting with service users with similar experiences. Now let's move on to stage 3.
So stage 3 is the repair stage. This is where clients will repair the damage to relationships, employment and finances, and self-esteem caused by addiction. This stage can prove to be a bit challenging because it's difficult for service users to see the implications of abuse on their everyday lives. And aspects of this stage can take a while because people often see some relationships and some of the damage as irreparable. The services that Project 6 offers includes Eat Well Wednesdays, which is a social activity which allows clients to repair relationships with family and peers. Keithley Progress Recovery Service helps to reintegrate clients back into the community by rebuilding social connections with others. This is particularly important because isolation from society is a key issue that contributes to relapse. And phase 4 of Project 6's alcohol recovery program tackles any damage to careers and livelihood by helping service users access training, higher education, work placements, and employment.
So recovery stage 4 is centered around growth, and in this stage is split into 2 key areas. The first area looks at dealing with family issues that and/or past trauma pre-addiction. So similar how recovery stage 3 looks at the issues post-addiction, this area looks at issues pre-addiction, and with this it looks at identifying and resolving such issues. The second key area looks at developing skills, and this is to help the person develop be able to cope with day-to-day living post sobriety. And with recovery stage 4, it typically happens over a period of 3 to 5 years post sobriety. And the key effects of these 2 areas is that it identifies any negative thinking that a person may have. It identifies any issues they have that could be relatable for other people. So it gives that sort of help aspect for the patient. And with this, it also challenges any fears that a person may have that could result to them relapsing. So with this, it looks at all the any negative issues, any issues they have pre and post addiction to help them essentially better their day-to-day living. So looking on to stage 5.
So in recovery stage 5, we put it as the relapse stage, even though a service user can relapse at any stage of their recovery. And it's important to talk about relapse because 70 to 80% of people do relapse on their journey to recovery, and the highest rate is between the first 3 months. So it's extremely important to talk about relapse and the different types of relapses. And the first type of relapse is emotional relapse, and this comes from the patient being unable to manage and control the inevitable emotional withdrawal effects that come from withholding, come from not consuming alcohol and drugs. Secondly, mental relapse. So this is the service user thinking about people, places, and things associated with past uses, or maybe thinking about opportunities where they can go and engage in relapse and consumption of drugs or alcohol. And lastly, physical relapse, where it's the physical act of consuming alcohol or taking drugs. And it's important to recognize that these relapses do overlap, that a patient can experience emotional and mental relapse with drugs and alcohol, and that can make them more likely to enter into a physical relapse. So Project 6 has a partnership with the NHS, and this is the in stage 1 of the alcohol recovery program in the Sheffield service. And in phase 1, it's the stage where you engage with recovery. So the service user attends weekly SMART recovery meetings, which is roughly around 1.5 hours. And it consists of cognitive behavioral therapy, which involves the NHS-based therapist talking through with the service user about their addiction, how to develop healthy coping strategies to overcome present and potential relapses. As also Fatma mentioned in her stage that she spoke about. And also they have group meetings where they can speak with other people who have had experience with addiction or progressing and wanting to recover from their addiction. So moving on to the key learning points.
So the key learning points are that Project 6 uses the recovery stages for service users to help with rehabilitation and understand how negative family patterns and other factors can hinder rehabilitation. One of the main points is that recovery from substance use is a long process and every individual is different. Therefore, it's often important for the service provider to tailor the needs of the service user and adapt their treatment accordingly. The NHS works in partnership with Project 6 to provide the best suitable self-directed treatment plan for individuals. And just a reflection on how we worked as a team whilst working on this project. We established the importance of being respectful to one another's point of view, and that we needed to understand that there will always be a conflict of opinions, hence making it imperative to find a suitable method to come to an agreement regarding a certain topic.
So we also reflected on the importance of team dynamics. So this relates to Phil Taylor's session that we had. So creating an environment for the team where people can express their opinion in a respectful way, and also creating working relationships that can last as well, since the project did start from around the early semester towards now the semester 3. And yeah, moving on to the next point.
So looking at the time management aspect, it can be split into two areas, the regularity of meetings and the content within meetings. So with us, we worked on the basis of flexibility, i.e. meeting when people were free, instead of having a strict schedule of meeting once a week, for example. And this was in order to minimize any risks of conflict being an issue in our project. But looking at the content of the meetings, we initially struggled with the fact that we didn't have a set structure in our first couple of meetings, and so it was quite hard for us to progress in a steady rate. But afterwards, we decided to set targets at the start of each meeting in order for us to know what to accomplish for each meeting, as in order for our group project to progress at a steady rate. So, but looking at both areas, it showed that we were able to keep progressing instead of regressing with each meeting.
A key value which Project 6 works by is integrity. Integrity leads to making right decisions for the team, and it's especially important in organizations like Project 6 as it enables the best possible care to be delivered to their service users. For our group, this value was very significant, and therefore we implemented this value into our group work. Being honest and having integrity enabled us to build a better relationship as a team, and it enabled us to be able to rely on one another, which greatly facilitated our workload and thereby enabled us to work effectively and with confidence.
Our last point was equal division of responsibility. So this meant ensuring that there was good delegation of tasks. This helped us to demonstrate our individual strengths and contributions to the group, as well as help us get work done faster and more efficiently. We were also mindful to remember to confer with other members of the group so that important decisions were unanimous.
Thank you for listening to our presentation. Hopefully you enjoyed it and got something out of it. Before we go and move on to questions, I'd like to show our references. This is our references that we use to follow the PowerPoint, and these are image references. Thank you so much for listening.